My name is Michael Alperovich. I'm an assistant professor of surgery at Yale. I specialize in plastic and aesthetic surgery. My reconstructive practice is centered on caring for patients with pediatric craniofacial conditions. My aesthetic practice is centered on patients related to the face, breast, and abdomen. Restoring a patient's appearance and ultimately confidence never gets old. I'm lucky that by improving the patient's quality of life, it has a ripple effect on every part of their day-to-day lives. As a father of 4, my children are the most important people in the world to me. I understand what it means when a parent places their trust in me, and I don't take that privilege for granted. In my early 20s, I was very fortunate to be able to travel to southern India, to a remote village where we performed cleft lip and palate surgeries. Our team worked 12 to 15 hours a day, taking care of patients who couldn't get care anywhere else. Entire families traveled hundreds of miles in order to be able to receive this care. Patients slept in fold-out beds, their parents and their siblings slept on the floor next to them. These children got a chance at a normal life. Their parents had hope, and I discovered my life's calling. My research focus goes hand in hand with my clinical practice. I study the same areas that I'm clinically productive in. More specifically, I evaluate the functional, the morphologic, the psychosocial, and the neurocognitive impact of the craniofacial conditions I treat, including craniosynostosis, cleft lip and palate, mandibular distraction, and ear deformities. When I advise a patient, my recommendations are grounded in the best available evidence. I really hope that in 20 years, I'm not doing the same thing in the same way as we are doing now. For instance, when we advise parents on craniosynostosis surgery, our research at Yale has shown that there's improved cognitive function if you operate at a younger age. Now I perform the surgery at closer to 5 months as opposed to 8 to 10 months, which is what I trained to do. I led the first study in the world to compare the multiple comparisons of different surgical techniques to repair sagittal synostosis. I compared spring-assisted surgery to cranial vault remodeling, and because of the evidence that we showed, we were able to find that there's an improved outcome if you perform surgery using cranial vault remodeling. For that reason, I offer cranial vault remodeling for my patients with sagittal synostosis. As a craniofacial surgeon, I operate on the skull, the face, and the jaw, where the difference of a couple of millimeters can make the difference between a good result and a great result. I leverage technology, computer modeling, 3D planning to get the best possible result for my patients. Whether I am trying to land a plate and screws on a 2-week-old baby who needs jaw distraction for trouble breathing, or plan the cuts for a frontal sinus setback for a facial feminization surgery, I leverage cutting-edge technology to provide the best possible outcomes for my patients.